everyone. Welcome to this diabetes education show by Herman Productions. Today, we will provide you some information about prediabetes. According to CDC, the Centers for Disease Control and Prevention of the United States, prediabetes is a serious health condition where blood sugar levels are higher than normal but not high enough yet to be diagnosed as type 2 diabetes. Prediabetes puts you at higher risk of type 2 diabetes, heart disease and stroke. Of the 88 million pre-diabetics in the United States, more than 84 do not know they have it. Isn't this a sad thing? Let us learn more about prediabetes in this program.
Ladies and gentlemen, thanks for giving your time to watch this educational video on prediabetes. In one of the reported survey on defining patient centricity, patients were asked about their expectations. One of the things which came out was that they expect transparent, unbiased information on their disease, treatment options, and resources. They want this information to be provided to them, their family members, and caregivers. To ensure transparency, whatever I will say today will be based on the published guidelines from the world's most respected professional bodies in the field of diabetes. These are the American Diabetes Association, the International Diabetes Federation, and the World Health Organization. However, let me clarify, none of this constitutes a medical advice, and you must consult your doctor for appropriate investigations and treatment. Putting it in a simple way, prediabetes is a condition where your blood sugar levels, fasting or post-meal, are already higher than the ideal or the normal values, but these are not yet as high so as to label you as a diabetic. So the question is, why should you get your blood sugar levels tested if you are not yet a diabetic? If you are above the age of 40 years, if you have a family history of diabetes, if you have a sedentary lifestyle, or if you have a body weight higher than the normal for your height, you may be at risk of diabetes. It is only when you get your blood sugar tested that you will know whether you are actually a diabetic or a pre-diabetic. Okay, so ladies and gentlemen, as I mentioned earlier, the diagnostic criteria of intermediate hyperglycemia, which is pre-diabetes versus diabetes, is shown here. So as you can see, for somebody to be diagnosed as pre-diabetes, the fasting plasma glucose should be in the range of 100 to 125 milligram per cent, and the 2-hour glucose following ingestion of 75 gram glucose load should be in the range of 140 to 199 milligram per cent, or the HbA1c values should be in the range of 5.7 to 6.4%. So this is how prediabetes is diagnosed, either based on the fasting plasma glucose, or based on the postprandial glucose, or based on the HbA1c values. Now, coming on to the risk for type 2 diabetes, as I mentioned earlier also, depending upon your age, depending upon whether you have a family history, depending upon whether you have a history of hypertension or your sedentary lifestyle or your body weight, there is a risk score which has been designed by American Diabetes Association. And if we look at this risk score, if your score is higher than 5 or even 5, then you are likely to be at risk of type 2 diabetes.
Thank you for telling the difference between diabetes and pre-diabetes. Now, we know when we should get our blood sugar tested.